Hi everyone. Today we are going to continue our discussion on the disorders of thyroid gland, and today we are going to refer to hypothyroidism. The learning objectives. At the end of this lesson, you will be able to identify the causes of hypothyroidism and explain the pathogenesis, signs and symptoms, and the diagnosis of hypothyroidism. What is hypothyroidism? Hypothyroidism is a type of thyroid disorder in which the thyroid gland does not produce sufficient thyroid hormone. That is, low plasma concentration levels of thyroid hormones T3 and T4. The causes of hypothyroidism can be due to defects anywhere within the hypothalamic pituitary thyroid axis, and accordingly, the causes can be classified as primary hypothyroidism. Deficiency of the thyroid hormone is related to the thyroid gland itself, and that is the most common cause of hypothyroidism. Then, the secondary hypothyroidism caused by TSH deficiency due to pituitary dysfunction. And the last is tertiary hypothyroidism caused by TRH deficiency, that is, thyrotropin releasing hormone deficiency due to hypothalamus dysfunction. Now let's discuss more details on the causes of hypothyroidism. As indicated here, there are different causes of hypothyroidism. Among these, the first is chronic autoimmune thyroiditis, which is most commonly referred to as Hashimoto's thyroiditis, or chronic lymphocytic thyroiditis, usually occur in adult, and it is about 20 times more common in women than in men. The mechanism of this disease is due to autoantibodies attack and destroy the thyroid gland tissue. The second cause is surgical removal of thyroid gland, which can be seen as a treatment of hyperthyroidism, such as thyroidectomy, surgical removal of the thyroid gland, or radioiodine treatment that destroy the thyroid tissue. Next is the central hypothyroidism. As we have just mentioned, this disorder is due to pituitary or hypothalamus dysfunction that either reduce the thyroid stimulating hormone TSH produced from the pituitary gland, or reduce TRH, thyrotropin releasing hormone, from the hypothalamus that will reduce the stimulation to the thyroid gland. The next cause is congenital hypothyroidism. This is commonly seen in children, whereby deficiency of thyroid hormone secretion during fetal development, which can be again either due to congenital absence of the thyroid gland or underdevelopment of the thyroid gland. The last cause of hypothyroidism is iodine deficiency hypothyroidism. This is the most common cause of hypothyroidism, which is due to dietary iodine deficiency, as the thyroid hormone formation is dependent on the iodine intake from the diet. And this is the serious condition, especially in children born to iodine deficit mother. The pathogenesis of chronic autoimmune thyroiditis, or Hashimoto's thyroiditis. Hashimoto's thyroiditis is an autoimmune condition whereby autoimmune antibodies attack and destroy the thyroid tissue. It could be either by blocking the TSH receptors, or the antithyroid antibodies may attack the thyroid cells. The autoimmune antibodies can be directed against the thyroid peroxidase enzyme or the thyroglobulin. Thyroid peroxidase enzyme and thyroglobulin are essential in the formation of thyroid hormones. And consequently, this will decrease the release of thyroid hormone T3 and T4 and increasing the TSH secretion due to lack of negative feedback mechanism. the signs and symptoms of hypothyroidism, as we have realized the importance of thyroid hormones in terms of growth, development, and increased metabolic rate. The effects of low thyroid hormones will have an impact on several organs. In terms of the integumentary system, the skin becomes thickened with fluid retention. That is called myxedema. Myxedema is a syndrome with clinical manifestation of thick, coarse skin and peripheral edema. The skin becomes dry and inelastic, and in addition, the hair pattern may become coarse and the eyebrow may disappear. With regard to the cardiovascular system, there is a decrease in heart rate, bradycardia, with weakened heart contractions, decreasing the overall functions of the heart. There is also decrease in cardiac output and slow circulation with fluid retention. With regard to the gastrointestinal system, hypothyroidism will slow the actions of the digestive tract with weight gain despite poor appetite. There is also decrease in gut motility and constipation is very common. In terms of the central nervous system, there is a decrease in mental stability and forgetfulness with slow intellectual process. Feeling cold and depression is very common symptoms of hypothyroidism. And in severe cases, these effects can be progressed to what is called myxedema coma, which is severe hypothyroidism that can cause a loss of consciousness, and hypothermia, that is low body temperature. In terms of the reproductive system, there is menorrhagia, that is excessive menstrual loss, and decreased libido and infertility. And lastly, the diagnosis of hypothyroidism. Blood tests can be used to identify the underlying cause of hypothyroidism by determining the plasma concentration of TRH, TSH, T3, and T4. And the most common blood test for hypothyroidism is thyroid stimulating hormone, TSH, since TSH will be elevated even with small decreases in thyroid function. As you can see in this table, if the defect within the thyroid gland, this will result in low T3 and T4 and increase TSH and TRH. However, if the cause is due to abnormalities within the pituitary gland, this will result in low TSH, T3 and T4, and increases TRH. Otherwise, if the defect within the hypothalamus, this will indicate decrease in TRH, TSH, T3, and T4. Thank you very much and see you in the next lesson. Thank you.